As an immigrant, I didn't realize what it means to have the American dream. And to have the American dream is to have the freedom that we cherish so much. But living 35 years in the United States has taught me that not everyone has the same freedoms and not everyone has the same opportunities. And still people dying because they don't have access to these core things that we believe so much.
Wyandotte County is a unique county in the state of Kansas, as well as the U.S. overall. It's one of 4 counties in which there's no longer a racial or ethnic minority population. In addition, some of the conditions for health in Wyandotte County are not optimal.
Looking at Wyandotte County, out of 103 counties within the state of Kansas, it is ranked one of the worst counties at 99 in health outcomes. So Latino health is much needed here.
The Latino Health for All Coalition is a coalition that was started by Steve Fawcett and his work group at KU. And they saw a real need for this population to have resources, to be heard, to have a voice that would help improve their health outcomes.
The University of Kansas received a grant from the National Institutes for Minority Health and Health Disparities to implement a specific model aimed at bringing together community partners to address health equity among Latinos. We've worked to bring together about 40 community partners from across different sectors of the community.
We put into action our core beliefs by bringing people to the table, to give them a voice so they can speak out of their concerns. And because it's one thing we can dictate what we want to and what we believe it's needed in Wyandotte County, but it's another thing when we bring the people into the planning solution.
Latino Health for All makes a difference for local Wyandotte County residents by working to create conditions in which there are more opportunity to be healthy and engage in health behaviors. To promote healthy eating, we've worked with the food retail environment, specifically restaurants and corner stores, to increase promotion of healthy foods. We've worked with local partners to improve the parks and the opportunities within parks to engage in physical activity. And we've also worked with healthcare providers to strengthen quality, culturally competent care.
What inspires me is the camaraderie that I have with all the people that's part of Latino Health for All, the people that's part of the committees, that we're all working to one thing and trying to improve the health of the Wyandotte County.
We're doing what we do because we care, and it's really exciting to be part of a coalition that really cares deeply, and that's the mission. We go forward with everything because we care.
I think that Latino Health for All is poised to grow its work over the next 10 years. We're focusing on strengthening partnerships and deepening those partnerships to be able to do meaningful work together.
The future is bright, and we need the community to give back. And if we really care about Latino health for all staying for the long run and years to come, we need to think closely about how we're going to sustain this work. It's not a short-term relationship, it's a long-term journey, but it requires dedication and patience.
I think Latino Health for All will always be bringing attention to inequities experienced by Latinos and other racial and ethnic groups. As long as we keep inequities experienced by Latinos at the center of our work, I think we'll always be making an important contribution in Wyandotte County.